Coronavirus continues to sweep across the world. Exponential explosion in cases, and many healthcare systems are on the verge of being overwhelmed. Hello, everyone. This is Chris Martinson. I'm here with your SARS-CoV-2 daily update, aka the honey badger virus. Why? Because it's so hard to contain. And we're going to get into some of that data today. But my message for today is this. This is a tricky beast, but we can do this. We absolutely can get our arms around this. But what we're going to have to do is we're going to have to make decisions on our own. We are going to have to be responsible for our own outcomes. We're basically on our own at this point in time. Very few governments have been able to get their arms around this outside of a number of notable places in China as well as in the Middle East. Kuwait doing an exceptionally good job at this, Bahrain as well. But here in the United States, doing a very poor job of it right now. So because of that, let's go to the numbers. We are seeing numbers like this. These are numbers from March 28th. That's yesterday, so that I can have the full day's numbers up here. The United States clocking in nearly 20,000 new cases. And Italy, looks like they finally got their arms around it a little bit. They were recording, if you remember, 8,000 cases per day. Got that down to 5,900, down to, I know, right? Over 10,000 deaths now in Italy. And new deaths have not cracked the 1,000 mark here, thankfully. Spain, also very, very high number of deaths there. And you're going to see more and more the countries that were able to impose a lockdown like Italy did, they're going to see their numbers flatten out like this. But countries that had a harder time doing that, such as Spain and France, also apparently having a pretty hard time getting its people to behave, they're starting to record lots and lots of cases. And that's going to be the case until the NPIs, the non-pharmaceutical interventions, which include all of the banning of mass gatherings and the education of the population so that everybody's wearing a face mask, everybody's practicing good hygiene, social distancing, things like that. Until you get your arms around those sorts of things, you see lots and lots of cases because this particular virus is a real beast. We are now very much on our way to seeing entirely 4-digit numbers in this column here of new cases, and someday it'll probably be 5-digit cases. And so as we look up and down this list, we see a couple of notable things here. Brazil still recording pretty big increases. Again, very low levels of testing going on there. So those numbers are low. In fact, they're low for most of these countries. Very few countries have an exception of doing what I would consider to be comprehensive testing. Germany, it seems like they're doing lots and lots of testing, but the way that they are recording, oh yeah, look at that big jump. They're no longer reporting 23 in serious or critical. But the way they're recording their deaths too, I've heard is not the way other countries are doing it. Read a report today that one of the things Germany has done is they're not recording you as having died from coronavirus if they can assign your cause of death to some other underlying cause. Like, I don't know, you had heart disease and your heart gave out, or, you had some kind of renal disease and your kidneys gave out. So if they can assign it to some other cause, that's what's happening. So that's why this number jumps out and is so different. Okay. Moving on, we still are in the exponential phase. We have 581,000 cases outside of China now. Still pretty much in a flat line, although if you start to squint in this, it's possible that we're starting to see a little, maybe that, I don't know. Don't really see it yet. Maybe if we zoomed in, we'll zoom in a bit, see what's there. Yeah, let's see. Maybe I can bring this. Nope, didn't work out. All right, I couldn't quite zoom in on that. So, this, if we did zoom in on this little piece, what we would have seen is that blue ball maybe is sticking down a little bit. Couple of reasons. It could be that the non-pharmaceutical interventions are starting to flatten this curve out a little bit, starting to get this bend over that we're waiting to see. Or it's possible that test cases are not able to keep up with the total number of case growth. And that's going to be a thing very soon. We're going to see reported fewer cases because simply the ability to test for these things is growing linearly in many countries, and the cases are growing exponentially. So that's a problem. All right. How do we beat this thing? Well, everybody wears a mask, and it's really good to see that now this idea is apparently coming out, and I've heard that there's a chance that the CDC is actually going to go against the White House on this thing and recommend that everybody wear a mask. Why? Well, because it works. There's still too much confusion, about this particular thing. Here's Jennifer Kiesmott saying, baffled by people walking around our local grocery store with masks on. If you have symptoms or are at risk, get the hell out of the grocery store. If you don't, why are you wearing a mask that's desperately needed for a healthcare worker? That was yesterday. And I don't really, not here to pick on anybody, but this is somebody with 84,000 followers, got 11.4 thousand likes, 1.9 thousand retweets. So this had a lot of traction. So I'm going to pull it up. All right, Jennifer, the problem is that you don't understand actually what's going on here at all. So there is this thing called asymptomatic transfer, and people can asymptomatically spread this thing. So that's why. And as well, many people who don't have symptoms, they might also, I don't know, have an underlying condition where they really, really don't want to catch this thing. And so they are a vulnerable person in the population. Those are a couple of obvious reasons why somebody who might be in the grocery store, right? So at any rate, let's look at the actual data. Here, the New Scientist just came out recently. That's on the 24th of March, saying you could be spreading the coronavirus without realizing you've got it. Yeah, that's true. But of course, we knew this we did know this 2 months ago. That data was out there a long time. So even in the New Scientist, we're seeing the scientific community in many countries just slowly get around to what I always thought was a fairly obvious conclusion, which is if you have people who are shedding the virus and they're asymptomatic, then they can spread it. But at any rate, this was a really good article because it did point out that now we've got some data to go with this, and this data gives a lot of conclusions that allow us to make some pretty powerful sort of predictions and other things. So let's get into it. With more than 380,000 confirmed cases worldwide, so this is a little old, 24th, you see how fast we're almost double that now. One thing is clear about the new coronavirus, it's very good at infecting people. Now studies are starting to reveal just how infectious it is and when a person with COVID-19 is most likely to spread the virus. So this is really important data. While we know some people are more vulnerable to the virus than others, it is capable of putting a healthy adult of any age into a critical condition and in need of intensive care. However, the virus can also be asymptomatic, causing no noticeable illness in some people. Such cases were first recognized in China in January, which is when we pointed this all out, but it wasn't known how common they were. Yeah, but under the precaution principle, we didn't have to know how common they were. The precautionary principle would say, until we know better, we're going to act as if this is true, and we're going to act as if this is a serious thing. And then later, when we get data that say, asymptomatic isn't that big a deal, then we unwind it. Unfortunately, the entire Western world, I would say, went the opposite direction from that precautionary principle and said, until you prove it, really, really double prove it, we're going to act as if this isn't the case. Well, it is the case. Asymptomatic transfer is a thing. So let's get on with this. Continuing here, quote, research published last week by Jeffrey Shaman of Columbia University in New York and his colleagues analyzed the course of the epidemic in 375 Chinese cities between 10 January, when the epidemic took off, and 23 January, when containment measures such as travel restrictions were imposed. So this tells you a lot before the NPIs begin to come in and bend the curve a little bit. If you just study how this thing spread before there was real awareness of it and before the lockdowns began, it gives you a pretty good sense of how easily it spreads. Plus, they were able to pull one other piece of data out, which is really critical, and it's this. Continuing, the study concluded that 86% of cases were undocumented. That is, asymptomatic or had only very mild symptoms. The researchers also analyzed case data from foreign nationals who were evacuated from the city of Wuhan, where the first cases were seen, and found a similar proportion of asymptomatic or very mild cases. And this also was true on the Diamond Princess, right? So we now know that undocumented or asymptomatic or very mild are actually a pretty big proportion. And this is critical when we get to the scenario A versus scenario B logic, which is it the case that already most of the population's been infected and we're therefore close to herd immunity, which is a very positive thing, or are we still on the other end of the spectrum? So here we're getting some data now to begin to tuck into the theories we've been pushing and promoting and exploring. All right, such undocumented cases are still contagious, and the study found them to be the source of most of the virus's spread in China before the restrictions came in. Let me read that again. The study found asymptomatic or undocumented cases to be the source of most of the virus's spread in China. Even though these people were only 55% as contagious as people with the symptoms, the study found that they were the source of 79% of further infections due to there being more of them and the higher likelihood that they were out and about. That's it. There's the punchline. There's the piece. So we're going to work with this, but first we know now that this is solid proof here. Asymptomatic, it's a thing. We've known about it. We now have solid data behind it. We've got a good study that actually sort of gives us something to work on. We're going to get back to this 86% number in just a second. But first, there's really still too much awful stuff coming out of the WHO. And here's yesterday's awfulness du jour from March 28th. Fact check, COVID-19 is not airborne. The WHO says here, not airborne, right? And they say that's incorrect, this theory that COVID-19 is confirmed as airborne. The virus that causes COVID-19 is mainly, not entirely, mainly transmitted through droplets generated when an infected person coughs, sneezes, or speaks. These droplets are too heavy to hang in the air, they say. They quickly fall on floors or surfaces. What's quickly? What's quickly to you? Quickly to me is the 5-second rule, right? If you're going to eat something off the floor, 5 seconds. So quickly is 5 seconds to me, or something. You can be infected by breathing in the virus if you are within 1 meter of a person who has COVID-19, or by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. That's true. To protect yourself, keep at least 1 meter distance from others and disinfect surfaces that are touched frequently. Okay. This message spreading on social media is incorrect. Help stop misinformation. Verify the facts before sharing. This is from the World Useless Organization over here. Let's, you know what I like? I like data. Why don't we go to data here for a second? Let's fact check the WHO on this one. Hey, here's something that came out today. It was actually written yesterday, but I only found it today. And this says 2 meter social distancing rule being used to keep people apart may need to be 4 times bigger to prevent coronavirus from spreading. A new study suggests. Whoa, I thought 1 meter was good. 1 meter. Who says 1 meter? Here they're saying even the 2 meter rule may need to be 4 times bigger. Oh, okay, 4 times 2, so we got 8 meters. So that means the WHO is at least a factor of 8 wrong, which is that's about normal for them. Currently, people are asked to keep a distance of 2 meters when out in the community, and many supermarkets have now stuck lines of tape to the floor to ensure adequate separation. But a new analysis by MIT, that's a pretty good outfit, in the U.S. has found that viral droplets expelled in coughs and sneezes can travel in a moist, warm atmosphere at speeds of 10 to 30 meters per second. That's up to 100 feet per second. Okay? Creating a cloud that can span approximately 7 to 8 meters. Okay? So, at any rate, you expel it, comes out really fast, and then next thing you know, you've got like this big up to 27-foot like cloud out there. It's not good. The researchers also warned that droplets can stay suspended for hours, moving along airflow patterns imposed by ventilation or climate-controlled system. Hours. They said quickly. So I guess to the WHO, quickly can mean up to hours. And fall on floors, after circulating around in your air vent system for a good long time. Is that I guess that's what's going on here. Virus particles have already been found in the ventilation systems of hospital rooms of patients with coronavirus. Yes, that's true, and we presented that data a little over a month ago. That was from Singapore, which the team believes could have been carried on turbulent clouds of air, which would be what else would you call that? Airborne. That's what we would call that. That's what that would be. All right, so there's no excuse for this. Is literally inexcusably bad. Inexcusably bad. Just shame on you, WHO. Terrible stuff. Remember, the gold standard pandemic approach, you halt all inbound infections. A lot of countries doing that now. Glad to see that, because that's what you got to do. But what's number 1B? Face masks for everybody. Face masks for everybody. So let's talk about that, because I really want to drive this point home, because anything we can do to help push this concept over the goal line is going to be really important. The sooner countries move to everybody wearing a face mask, the better. Is it perfect? No. We have to do lots of other things in conjunction with that. But is it the best, easiest, simplest, most cost-effective first step we could take? Absolutely. Hands down, no question about it. So why does everyone wearing a mask work? Well, first thing is it stops the spread of the virus from infected people, and that includes both
symptomatic and asymptomatic people. So let's look at this real quick. What you're looking at here is this is going to be a video using very, very specialized imaging techniques, which you can see the outline here. Here's a person. Here's a person. They're just talking. And what's being captured by this video process are the particles that are coming out of their mouths while they're talking. Okay? See all those particles floating around? Some of those are going straight to the floor. You see those? You see those ones that just dropped out? Let's rewind. Let's watch this again. See when they talk. Some of these drop very quickly. They're right. See those? Watch those ones that drop quickly. See that? Yeah. Those drop very quickly within a meter. But look at the rest of them floating around. Every one of these is large enough to be imaged, which means it's large enough to carry millions and millions of virus particles, if not more, and it's plenty to infect somebody. So why does wearing a face mask work? Well, if you're wearing one of those, then you're going to be ejecting fewer of those particles. If we reran this and these people were wearing face masks, you wouldn't see any of these particles floating around. They would all get caught in the mask, right? Or nearly all of them. Maybe some of the tiniest ones might escape through, but 99% of those particles aren't coming out to float around. So what's awesome about that? Well, you get fewer particles in the air. And then that means there's less contamination to clean from surfaces for starters, right? So that's all goodness. All right, so let's keep moving on here. The second reason why everyone wearing a mask, why does it help? Because it helps remind you to not touch your face. Hey, I do it. We all do it. It's really hard not to touch our faces. It's instinctive. If you have an itch on your nose and you're talking to someone, you're not even going to think about it. You're just going to scratch your nose. And so, this is from livescience.com and asking, I like how they put this, why does your nose itch whenever you try not to touch your face? That's what happens to me. As soon as I think about not touching my face, my nose really itches. Ignoring an itchy nose or hair in your eyes is easier said than done. Even professionals who should know better get caught by the impulse. Medical school students being trained in infectious disease prevention, for example, touch their faces 23 times an hour during a lecture, according to a 2015 study in the American Journal of Infection Control. So having a mask, that's the second reason we wear one, is it reminds us not to touch our face. Or even if we impulsively and unconsciously go ahead and touch our face and go to rub our nose, there's a mask there to stop us from really doing anything. Here's a third reason we're all going to wear masks. And because we want to start low, remember I put this out a while ago, and this was in, I believe, March 15th's daily update. And here's this doctor, Rishi Desai. He's the chief medical officer at Osmosis Infectious Disease Physician and former outbreak investigator at the Center for Disease Control. And he talked here about how if you start with a low inoculum, meaning you get just a few virus particles rather than a giant contamination load, that those low doses are associated with better disease progression, that the high doses you might get, the high inoculums, that those tend to progress more rapidly to serious cases, which is why so many healthcare workers get seriously infected or seriously hurt. Why? Because when you start with a low inoculum, your body has hours and hours and maybe even days as that virus is building up from a low number into higher numbers to begin to adjust to that, to begin to respond to that, begin to mount a defense. When you start with a high inoculum, your system gets overwhelmed, your body doesn't have as much time to adjust, and the virus gets the upper hand. So that's the third reason we're going to wear a mask. So there's three reasons why everyone should wear a mask. First, it stops infected people, symptomatic or asymptomatic, from expelling infectious particles. That's the biggest. Two, it helps remind you to not touch your face. That's important. But if you get infected anyway, like you have even just a cotton mask and it stops most of the particles, but not all of them, but the ones that do sneak through are fewer in number and smaller in size. So that gives you a much better chance of starting small. That is with a low inoculum. And that means you're going to have a much better disease outcome. That is a milder case of the disease. That's what the data says right now. Hey, you could still start with a low inoculum and have a bad run of it. We don't know why, that happens, but it can happen. But this improves the odds. This stacks the odds really much in your favor. Excuse me. I need a glass of water or something here. The Czech experience. Remember, we highlighted a great email from somebody that came in about the Czech experience. And so let's look in here now. The former First Lady to the Boy Scouts, Czechs ramp up home mask production. The former First Lady and wife of the late Václav Havel uses old theater drapes
Boy Scouts work with donated materials. Others cut up old T-shirts as checks create homemade masks to fight the coronavirus. And I love this. It was even before the government ordered people to wear masks. And that's what you can count on the government to do usually, is to order something after people are already doing it and then claim victory. So good job there, government. But the people of the Czech Republic had already decided to wear face masks or use something else to cover their mouths and noses when in public. All right. And they had already ramped up their own home production lines. Pictures on social media showed people waiting in line several meters apart in front of fabric stores, while the former First Lady, Dagmar Havlova, began making masks from theater drapes and discarded linen from a villa she shared with President Havel. "We're not enough and we are tired," she posted on Facebook. "We need mainly seamstresses now. If you are from Prague and can work, let us know." So this is how it's done. And, so that's the theory. How's it working out? Hey, it's working out great. Got this from March 29th. Usage of face masks has flattened the growth of coronavirus cases in the Czech Republic. It does work. The growth of coronavirus cases has flattened in the Czech Republic ever since the country's government, the people, made mask compulsory, claimed data scientist Jeremy Howard. Howard claimed that one of the key reasons for the decrease in the growth of cases is a massive countrywide community initiative to create and wear homemade masks. In just 10 days, the country went from no mask usage to nearly 100% usage, with nearly all the masks made at home with easily accessible materials like old T-shirts. All right. We've got the data there, and we had the circumstantial data before. We saw this. Here are all the different countries. And then we noted that these are the countries that have both their masks plus. A lot of these also have really good social distancing and other NPIs like that. So Hong Kong had school closures, quarantine, community response, plus masks. Singapore had strict quarantine rules and contact tracing, plus masks. Japan has strong social norms around civil obedience and mask wearing. Great. South Korea, huge test and trace program that got on top of the outbreak, plus masks. China, everybody's wearing masks, of course, plus all of these sort of measures as well. And so that's why you saw China flatten out like that. Okay, that's how you flatten the curve. Masks have a very important role to play. So this olive oil guy at Peak Prosperity, where we've got great conversations, please come by to the site if you want to follow up on things like the data we see here and other things related to how you stay safe and become resilient. Noted that made a great post here that says everyone wearing masks now has proven to work in the Czech Republic. Hey, very achievable. My eldest daughter, Erica, is busy sewing masks and has been for weeks now and has been on this train for a while here in the United States. Start with a bandana or any covering. It's about 50% effective. Hey, you could upgrade to a homemade sewn mask with a tighter fit and better materials, much more effective. Put a sleeve in a homemade mask and put a vacuum cleaner filter media inside. Hey, even more effective. And then buy N95 masks when they become available soon, and that's the most effective. All right, so anything, can do it, even a bandana. And I like Olive Oil Guy's solution here. So reports he was one of 4 people wearing a mask at the grocery store and wore the bandana over it so that he would look cool. Hey, that's the way to go about it. You look like in Texas, you can pull that off probably, maybe with a gun on the side. Remember, the reason that anything works is because you've got all these particles floating around, and it really works to help stop them from coming out in the first place and stop you from breathing them in the second place. So that's why even a bandana is somewhat effective. All right. So you've got a mask, you're wearing a mask. Maybe it's a home sewn job or something like that. So the question becomes, how do you sterilize a mask? Because you don't want to just burn through one a day. And the good news is these things are sterilizable. So here's what you do. Here's the data. They did this on SARS coronavirus. So they studied the stability of SARS virus, put them into a variety of conditions, and then checked to see if they were still infective in cell cultures. So were they still viable particles? Because you want to make them unviable, of course. So what did they find here? Viruses stayed stable at 4 degrees C and at room temperature and at 37 degrees C for at least 2 hours without any change in infectious ability in cells. So that's the first thing you need to know. If somebody sneezes and you saw those big particles flying out of their mouth and landing on something, even at 37 degrees Celsius, 2 hours later, they're still very infectious. So once a contaminated person has been in the area,
the surfaces remain bad for a long time, which of course is why we want to wear the mask so that we don't contaminate all those surfaces. That's awesome. All right, but hey, let's look at this. They were converted to be non-infectious after 90, 60, and 30-minute exposures at respectively 56 degrees, 67 degrees, and 75 degrees Celsius. As well, we might notice that irradiation of UV for 60 minutes on the virus in a culture medium resulted in destruction of the viral infectivity at an undetectable level. So that's in a culture medium, that's in a liquid. It doesn't tell us much about if you were going to decontaminate with a UV on a mask. Should work. And again, I don't know from this study what sort of the concentration of UV was. That is, how many watts per square meter, what the intensity of their UV was. So I don't have great data for you on UV yet, and I'm sure it's out there. I just haven't found it yet. So what does that lead to? Our top recommendation for mask sterilization is to put it in a paper bag, fold it up, and put it in an oven for 30 minutes at what's presumably going to be your lowest setting. The lowest setting on my oven is 200 degrees. So again, SARS was killed in 90 minutes at 56 C, which is 132 degrees. After 60 minutes at 152 degrees, or in 30 minutes at 167. So if we're going out to 200 degrees on our oven, if that's the lowest we can do, let's just go 30 minutes. Good to go. So what are your steps? You want to preheat the oven. Some of you guys and gals out there with gas ovens, you're going to make these catch on fire if you put them in there and then turn the oven on. Don't do that. Preheat the oven. Confirm the temp with a thermometer if you've got one. Just make sure your oven's actually working, so you want to make sure that you're achieving these temperatures for these times. Go ahead, place the bags in, set the timer based on your temperature, and then go ahead and remove that bag and place it in whatever rotation you have going on. That's our top recommendation. We also have one other top recommendation, which is time. 9 days is the max that any of these viruses have been found to live on any surface. They survive more poorly on things like mask surfaces. The 9 days was under perfect conditions on steel and perfect humidity and stuff like that. So what do we do here at home? We put them in a bag. We put the date on the bag, and we just wait. And to really help things out, we throw the bag into sunlight. I'm sure 9 days and the sun is really overkill. But if you have 9 masks and you need to go out every day, that's how you would do it. We're not recommending no microwaves, no microwaving. We don't have any data on it, but that's particularly true if your mask has a metal strip like this does right here to bend over the nose. You can see the metal strip on these respirators here. So if you have any metal, of course, don't use the microwave. And we don't have any data yet to say if a microwave is good or if it's bad or how it works or any of that stuff. This works. This works. So let's just go with what works. All right. My prediction is that when we have this idea of a low inoculum, we talked about this for a while at my website, so I'm just going to put it out here in the public. The prediction is that we may end up infecting on purpose as things go forward. And the idea here, the logic is that once we understand why some people get it worse and some people don't, and we confront the fact that people are going to get this thing anyway, and that we need to get to herd immunity, we're going to begin inoculating otherwise healthy people with the smallest possible infective dose, right? And that way they're starting with the smallest dose, gives their bodies time to ramp up and mount an appropriate defense, because that's how we get better from this thing. Our bodies fight it off. Either our bodies fight it off or they don't. If our bodies don't fight it off, hey, we die. But that way we're starting not with a mega dose, if you just allow us to all accidentally get it whenever we do, we're sometimes going to get... that's an uncontrolled environment. A lot of people are going to get it in an uncontrolled way, meaning a much, much larger dose or inoculum than they would need to start with in order to have become sick. So that may happen. And then we should have some ways, like armbands or badges or something that people can wear so that everyone who's had it can wear those and display it so we can see who that is. Because it's going to be really helpful to know who is no longer infectable or infective, and knowing who these healthy people are now, or immune people, is going to be really important, particularly as we start to try and fill in mission critical jobs and we need people to come forward and help out. And I would love to know who's not infective anymore and who's got the immune response. That would be really helpful to know. All right. Remember, we talked about scenario A, where this thing's got a long way to burn because we've only
very few people have got it so far, and we had a lot of data to support scenario A, including the population-wide testing in Iceland, the town-wide testing in Italy, to suggest that maybe about 1% of all people in those countries in those locations had been infected. But then there's this theory going on that it's actually scenario B, that most people have already been exposed to it. We're very much closer to herd immunity than we thought. That would be good news. Very important. Where are we? Scenario A, scenario B. Where are we? So I want to call back to that study that I started with way back up here. And let me see if I can pull that back up again. This one about the asymptomatic infectivity. There was a really critical line in there that I said I was going to get back to. So here it is. It's this line. The study concluded that 86% of cases were undocumented. So that means that's nudging us towards scenario B. But let's be really clear about this. And so I ran the numbers. And if I did the numbers right, it looks like this. If we said that 86% of people were undocumented, so 14% are reported. Those are the reported cases that were, being flashed across the headlines. If under that ratio, that means that for every 100,000 reported cases, there's going to be 714,000 undocumented cases, because that's how that ratio works out. Which means that in the United States, which has 320 million people, the implied number of reported cases we have to get to in order to get to that magic 80% herd immunity number, if that's the right number we want to get to, means we're going to have to see 35 million people being reported as being infected. And just to put that in context, the United States is currently at 123,000, and this number was 35 million. So this isn't solid data yet. We're still waiting for the solid data, which is going to be the antibody testing in the general population. It should be randomized. It should be sampled in various areas, hotspots, not hotspots, not just people who come to the hospital, because what we need to know is how many people in the population have already been exposed. And the way you get that data is you go out and you do antibody testing. And so that's to show that people, you would do PCR tests plus an antibody. That would be the gold standard, because some people may be asymptomatic, still shedding virus particles, maybe haven't developed antibodies to it yet. And you want to detect them as well as the people who've already had it, resolved their cases, and already have antibodies, and therefore are clear and clean. Okay? All right. Remember to resubscribe. People are still getting unsubscribed from this channel all the time. And if you could, very simple, just hit that like button. It's right down there, right below you here. If you could just do that, that really helps us, because it helps the YouTube algorithms say, hey, people like this, and helps get it out a little bit more widely. If we could just get this logical, data-driven view of why we all need to wear masks out there, that would be a huge help. So not asking for much. If you liked this, please click the like button, and that helps everybody. All right, conclusions for today. Asymptomatic spreaders are responsible for the majority of new cases. That's what that study says. That's a really important conclusion up there. It's why everybody's got to wear a mask. Okay, the WHO continues to pump out inexplicably bad communications. Let me wander to an opinion. I think they just ought to be defunded. Why should they be funded if they're going to behave like that? Let's start over. Something broken with that organization is all I can say at this point. With 86% of cases undocumented, that implies that countries will need to get to 11% of their total population to achieve immunity. So 11% of their total population is being with reported confirmed cases. That's what that ratio implies. So this is about 11% of the United States population. So that's just how the math works right now. As always, we reserve the right to tighten it up when better data comes along. So about 35 million in the U.S., but if you want to know how many people in your country would need to be reported as having been infected in order to achieve herd immunity, it's going to be about 11% of total population. Remember, everyone should wear a face mask. 3 reasons why. 1, to stop the symptomatic and asymptomatic spreaders from spreading it. 2, to help us not touch our faces. And 3, because if we're going to get it, let's start with a small dose, not a large dose. That's what the logic tells us. That's what solid data is telling us at this point in time. That's the best we can do right now. But remember, it didn't have to be this way. We knew about this stuff months ago, and that we're still trying to have to make the case for asymptomatic spreaders at this late date tells us that we had a really inappropriate response to this and that it didn't have to be that way. And other countries managed to figure this out a long time ago. I keep mentioning them: Taiwan, South Korea, Kuwait, Bahrain. There are a variety of countries out there, Singapore, that get it. So they showed how it could be, and we're showing a different way to go. So remember, wear a mask. Be safe, everyone. We'll talk to you next time.
Hi folks, Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.